Hello, I am Dr. Gurpreet Padda, and we are broadcasting from Injury Experts, located at 4477 Woodson Road, Suite 103, right next to Lambert St. Louis International Airport. Today, we are performing a forensic audit on why your chronic pain persists despite your compliance with standard medical protocols. We live in a state of systemic biological collapse. According to recent nationwide NHANES data, barely 1 American in 8 still meets the definition of being metabolically healthy. We have become an endangered species. If you are struggling with persistent pain, you likely do not have a pain problem. You have a data problem. Your body is a complex adaptive system that has drifted dangerously out of balance, and the pain you feel is the final signal that your underlying terrain is in crisis. The medical industrial assembly line treats pain as a diagnosis, but pain is merely a signal. It is the check engine light for your biology. When your metabolism is dysfunctional, your visceral fat ceases to be a simple storage depot and becomes an active endocrine furnace. This white adipose tissue recruits immune cells that secrete pro-inflammatory cytokines like tumor necrosis factor alpha and interleukin 6. In our clinic, we refer to this as chemical gasoline. When these markers remain chronically elevated, they trigger neuroinflammation and central sensitization. This is a state where your nervous system becomes hypersensitized and amplifies every signal. A light touch or standard movement begins to feel like a significant injury. If we do not quench this systemic fire, your tissue is simply too inflamed to heal. Let us look at the analytical reality of conditions like fibromyalgia. Research published in PLOS 1 by Papola and colleagues found that 79% of fibromyalgia patients show objective signs of insulin resistance. We must also discuss the role of leptin. While traditionally understood as a satiety hormone meant to regulate appetite, in a metabolically broken body, leptin acts as a potent pro-nociceptive signal. Daily fluctuations in serum leptin explain approximately 50% of daily pain intensity in fibromyalgia patients. In cases of osteoarthritis, higher levels of leptin in the joint fluid directly drive the matrix degrading enzymes that eat away at your cartilage. Treating this with a simple steroid injection or an opioid is akin to silencing a smoke alarm while the house is actively burning. Persistence in pain is also heavily driven by your circadian biology. When you lack restorative sleep of 7 to 8 hours, your morning cortisol levels remain elevated. High cortisol environments are catabolic and prevent your tissue from repairing itself. Furthermore, sleep disturbance increases systemic CRP and interleukin 6 levels. We reject the assembly line model that ignores your sleep and your gut health. We know that 99% of our patients have at least 1 or 2 social determinants of health, like financial debt or loneliness, that act as biological stressors. Loneliness has been shown to be a greater predictor of mortality than high blood pressure or obesity. It keeps your system in a state of high alert, which prevents the downregulation of your pain signals. We must bring humility to this conversation and recognize that our current medical model is designed to milk the cow rather than cure it. Over 90% of our $4.5 trillion healthcare spend is consumed by chronic diseases driven by metabolic dysfunction. The Medicare Trust Fund is effectively an aqueduct that is leaking because we are medicating a food-induced pandemic. We continue to prescribe opioids and NSAIDs for metabolic problems. Every opioid prescription written for a metabolically inflamed patient is another match thrown into a form that is already ablaze. Standard interventional procedures provide significantly poorer relief in patients with elevated high-sensitivity CRP. If the biological soil is toxic, no procedure will provide a lasting outcome. At the Padda Institute and Injury Experts, we do not just play music while Rome burns. We are the clinical commanders who fix the terrain. We perform a physiological audit of your health by measuring critical markers like LDL particle number and high-sensitivity CRP. We use metabolic medical management, including insulin sensitizers like metformin, to reduce neuroinflammation and lower your pain threshold. We recontextualize your recovery. It is not about willpower, it is about fixing a hacked neurochemical system. Sovereignty is your responsibility, and we are here to provide the data that the system wants to ignore. Identify the signal, intervene intelligently, fix the underlying terrain. Stop being a line item on a corporate spreadsheet and reclaim your future. Address 4477, Woodson Ard Suite 103, Woodson Terrace MO 63134. Text to schedule 314-886-5902. Schedule directly at calendly.com/padda/injury experts. Explore the data at concussion.center or injuryexperts.us. Join us at Woodson Road.